Preventive care is really shifting the model in how we think about medicine. For a long time, medicine has been something that was done to you. A lot of the history of medicine started with the barber surgeons, and so it was physical procedures. Around the time when we developed antibiotics, it became easier to use medicines to treat things that used to have to run their course. People didn't live as long and began living longer. Medicine took a turn into where, again, it was sort of treating disease. But as we've lived longer and longer, more of the problems are problems that are a result of living longer. They're diseases that accumulate. So we think about heart disease and plaque building up in arteries. We think about arthritis and degeneration of tissues. And so a lot of the idea of preventive care is shifting that focus again. So instead of taking pills or having surgery, it's trying to prevent those things, trying to live in a way that, that allows us to avoid or delay the onset of some of those illnesses. It turns out now that most of the illnesses that we struggle with, in America particularly, are degenerative illnesses, and illnesses that most of the work that can be done is work in prevention. Why is preventive health care important? One thing that a lot of people are concerned about these days is how much health care costs. We know that healthcare costs are rising 10 to 30% a year. Insurance costs seem to be rising that fast for most of us. And one way to think about preventive care is that it helps us avoid getting sick. The cheapest form of healthcare is being healthy. And so a lot of the focus on prevention is learning how to live in a way that achieves that, so that you really don't end up coming to see doctors very often. So I think there's a lot of benefit in it. Because it allows you to take more control over your own life, it allows you to achieve better outcomes. And we're fortunate because it turns out that most of those choices, most of those lifestyle choices really have to do with patterns that work across heart disease and cancer and helping us live highly functional lives. So, for example, right now there's recommendations that we exercise for something around 150 minutes a week or 30 minutes 5 days a week. I think that that's very good for helping us maintain weight. It helps us with our cholesterol. It can help us with blood pressure, all of which are good for heart disease. But it also turns out that exercise is good for cancer prevention. Similarly, there are dietary recommendations. We recommend that people eat protein with every meal. We recommend lots of produce. Right now, with such a high rising tide of diabetes in this country, we recommend trying to minimize carbohydrates in our diets. It turns out, again, this type of eating also tends to have benefits in cancer prevention. So we're choosing ways of living that help prevent lots of different illnesses. Finally, we need to think about stress management. You know, these days life is stressful, and we need to find activities that help reduce those stresses. Some people find, again, exercise helpful, things like yoga and meditation. But again, we know that in people who are taking these steps, we see lower rates of heart disease, we see better outcomes in cancers. So a lifestyle that seems to achieve all of these things, and we're really encouraging that. In terms of getting started with it, it's like a lot of things. It's important to kind of know where you are. So I encourage you to come see one of us. Come get a physical exam. Learn what your cholesterol numbers look like. Look at what your blood pressure is. You need to know something about your family. A lot of the risk we face comes out of our genetics. And so if you know certain things run in your family, it'd be good to tell a doc about that. And then from there, we can design a plan for you to try and minimize those risks. We can see what you can do on your own, and we can try and add medicines if they're necessary to try and treat what you can't do on your own. But we feel that most of the important things that people are able to do, the things that really matter in preventing illness, are the choices that you make and the activities, the exercise, the diet approach that you take rather than the medicines that we're prescribing.